Welcome to an overview of Tier 1 of the West Virginia Expanded School Mental Health Framework. In this video, we'll take a closer look at implementing Tier 1 universal prevention programs. We will discuss what Tier 1 looks like, what it is all about, important components, and expected outcomes. The West Virginia ESMH mini webinar series covers 12 topics that will help schools and their partners gain a full understanding of the expanded school mental health model and prepare for implementation. This video is the second in that series. I'm Crystal Criswell, School Mental Health Coordinator from the Marshall University School Health Technical Assistance Center in the Division of Community Health within the School of Medicine. This video series is presented by Marshall University School Health Technical Assistance Center, Division of Community Health in the School of Medicine, with funding from the West Virginia Department of Human Services Bureau for Behavioral Health. Our learning objectives are: first, to increase understanding of Tier 1 of the West Virginia Expanded School Mental Health Framework, and second, to provide relevant resources. Let's do a quick review of the 3 tiers of ESMH. Tier 1 serves all students and includes universal prevention and promotion of mental wellness. Tier 2 provides early intervention and selective supports for at-risk students who are identified with behavioral, academic, attendance, or emotional needs. Tier 3 is the most intensive level of intervention. Services may include clinical mental health therapy and/or intensive interventions that are provided by qualified mental health professionals in a school setting during the school day. This video will focus on Tier 1, which serves all students, the whole school, and includes universal prevention and promotion of mental health wellness. Tier 1 is all about using evidence-based programs that support the growth of the whole child in building skills and knowledge needed to be successful in school, at home, and in the community. Sample skill areas include communication skills, anger management, decision-making, healthy coping, suicide prevention, substance use prevention, and more. What does Tier 1 look like in schools? Tier 1 is delivered by teachers, school counselors, prevention organizations, or in partnership with community agencies. Some schools opt to provide Tier 1 lessons during advisor-advisee, developmental guidance, or health classes. Lessons are provided at regular intervals and integrated into the standard school schedule. There is no need for a special event, and large-scale presentations are usually not advised. The ESMH framework requires the use of evidence-based programs, or EBPs for short. These Tier 1 EBPs are widely used in West Virginia. For a comprehensive list of approved programs, refer to the WVESMH.org website. Tier 1 programs are most successful when teams include these important pieces of implementation. The ESMH leadership team should use school data to determine skill areas most needed by the students and select programs that address those topics. Sources of data may include the WV system, Zoom West Virginia, learning environment surveys, SAT referrals, and 504 or IEP plans. Align your universal prevention programming to meet state legislative requirements. In West Virginia, this includes suicide prevention, body safety, bullying prevention, and student supports. The school that collaborates with community providers to deliver these prevention-based programs and services may have a better chance at sustaining their efforts, since the responsibility of implementation is shared. Tier 1 programs provide a formal process to identify and refer at-risk students for further support in the expanded school mental health system. Leadership teams who take advantage of that process are more likely to see a reduction in critical incidents. Schools should remember to include staff training and support to ensure champions aren't the sole facilitators of selected programs. Multiple trained staff members add stability to implementation. Finally, it is vital that administrators fully commit to the ESMH framework and that leadership teams involve staff in decision-making to ensure staff buy-in. What outcomes can we expect from good implementation of Tier 1 universal prevention? All students are supported in the regular learning environment. Schools with good Tier 1 programming experience fewer critical incidents because students develop and practice skills for success. Early identification of the need for additional support prevents exacerbation of difficult issues. The West Virginia ESMH website has many resources and tools for your convenience, including detailed information about our framework, a 10-step implementation guide, approved evidence-based programs per tier for grantees, an extensive resources page, and a news and events page where you can see highlights from ESMH and AWARE grant sites, as well as upcoming trainings. We encourage you to check out all of our videos on the Marshall University School Health Technical Assistance Center's YouTube channel. Thanks for joining us for Tier 1 of the West Virginia Expanded School Mental Health Framework. Check out our other videos in this series where we explore different components of the West Virginia ESMH framework.